Everyone, being dental professionals, you might be already familiar with the 5 steps of complete denture fabrication, but how well do you understand it? If you are someone who's facing any problem in any of these 5 steps, then this particular video is for you. Hi, I'm Dr. Nair. I'm a prosthodontist by profession, and today I'll be orienting you about various steps in fabrication of a complete denture. I'll be mainly emphasizing on the preliminary impression and basics of impression making. Let us understand why making an impression is so important while fabricating a complete denture. There are many people who would say that this is the most important step in fabricating a complete denture. Now that is because you are fabricating a complete denture with an indirect procedure. By that what I mean to say is you are fabricating a complete denture on a cast. So the accuracy of the cast is going to determine how accurate the fit, the stability, the retention of your complete denture is going to be. So for an accurate cast, you also need an accurate impression. We are very familiar with the procedure of adding material onto the tray and then just molding manipulating the cheeks and the lips in such a way that the material get molded. But very few of us understand the science behind the molding procedures. We don't know why in a particular fashion we are molding the lip. We don't know why in a particular fashion we are going to mold the cheek. Why we are going to make the patient do certain movements with their tongue or with their mandibles. So this is the main focus of this video. This is the knowledge that I intend to share through this video. Now, impression, we say that we make the impression rather than take it. That is because as Divan said, you should the impression actually should meet the mind of the dentist even before it meets the hand. As in, you make the impression in your mind first. As soon as you view the patient's ridges, you should know how your impression is going to come out to be. This can happen only when you have an in-depth understanding of the procedure that you're going to do or perform on your patient. Now, I'll be starting with basics of impression making so that you understand the tissues a little bit even before you understand the procedure. So the impression making, based on the theories, we have 3 theories. First we have muco-compressive, mucostatic is the second one, and the third one is selective pressure. I'm going to start with mucostatic. Break the word in order to understand the word better. So I'm saying mucostatic. So mucosa, static means recording the mucosa in a very static state. So here this is also called as a non-pressure or minimal pressure technique. So the impression essentially is not going to displace the mucosa. But this particular impression technique was discontinued because the retention that was achieved with this kind of a technique was minimal. So to compensate or say to overcompensate, we came up with another method of impression making, that was muco-compressive. Mucosa being compressed. So in this particular technique, the proponents believe that if you're going to record the impression with the mucosa in a compressed state, we will achieve more amount of retention, which was true. We do achieve more amount of retention with this kind of a technique, but what was sidelined was that the mucosa has a rebound phenomena. After a period of time, the mucosa, when it's in the state of rest, is going to come back from a compressive to non-compressive state. It's going to relax, and the moment that happens, it would essentially happen when your patient is not speaking or not biting or passively speaking. In this kind of situation, the mucosa, the rested state of mucosa will dislodge your dentures. Because of this reason, even that theory was sidelined. Then came the theory that we currently use today, the theory that I am going to be explaining about while I discuss the impression procedures, that is the selective pressure technique. So in this technique, it took out the good part out of the mucostatic and good part out of the mucocompressive in order to provide your patient with a better and comfortable experience out of your complete denture. So this is when the stress bearing and stress relieving areas of the jaw came into picture. The proponents believe that there are certain areas in your jaw which are capable of bearing the stresses that can be applied, and certain areas which are not very forgiving. They can't bear the stresses. So the proponents, they decided to go ahead and apply pressure, selective pressure, onto the areas which are capable of bearing the stress and relieve the areas which were unable to take the stress. So those were the 3 techniques of impression making based on the theories. Now we have Another two techniques wherein it is dependent on whether the patient's mouth is open or closed while making the impression. Most of the dentists these days, they go ahead with the open mouth technique. So here what we do is we have to place a tray in the patient's mouth and we have to manipulate the tissue so as to record the borders. Next is the closed mouth technique. So in this kind of a technique, we take the impression of maxilla and mandible simultaneously, and as you can see in this picture, it is very important to have either an occlusal rim or the teeth arranged while making this impression, so that the patient is asked to bite onto the upper and lower rims or upper and lower teeth, and in that process only we record the tissues, or say we make the impressions. Now next very important aspect of impression making is the position of the practitioner and seating position of the patient. So I'll be demonstrating that even before we go ahead to the main part of this video, so that the start of your procedure is better. Move on to the main part of this video, that is recording of the primary impression. It is also called as preliminary impression. The main purpose of this is to achieve a primary cast. For recording the primary impression, we can make use of plastic or metallic trays. Most of the practitioners these days, they prefer using metallic trays over plastic because of the stability that we achieve. Now these trays can either be perforated or non-perforated. It is mainly dependent upon the material of choice that the practitioner prefers to go ahead with. If you're preferring to go ahead with alginate, that is irreversible hydrocolloid, then you should go ahead with perforated tray. And if you are somebody who is preferring impression compound, or the patient's oral cavity is such that impression compound is a material of choice, so you should go ahead with non-perforated trays. There are certain conditions wherein certain type of material should be used. I'll be covering that in detail in the upcoming video. It's a good idea to start with the mandibular impression first, because there are many people who are very sensitive in the posterior region of their maxilla and their gag reflex is too much. So in such kind of cases, if you start with the maxillary impression and if the gag reflex gets stimulated, they probably will be uncooperative for the next part of the procedure when you'll have to go ahead and take the mandibular impression. So always start with mandibular and then go ahead with maxillar. So second aspect is that when you introduce anything to the patient's oral cavity, there will be a lot of salivation. So with excess saliva, it becomes difficult to record the mandibular impression, but with maxilla, it's okay. Even if the salivation is more, you can still go ahead with an accurate impression. Always, for these two reasons, start with the mandibular impression. Now I'll be demonstrating how to use the material, how to manipulate the material laid on the tray and then make a very good impression. Now I'll be explaining the procedure involved in taking an accurate mandibular preliminary impression. First of all, selection of the tray. Select the tray that is of an appropriate size, and how do you determine that? For that, you have to place the tray onto the patient's residual ridges, such that the tray covers the residual ridges completely. In case of mandible, make sure that the distal extent of the tray is covering the retromolar pad. So and the tray has at least 5 mm of excess space when you're placing it over the ridge, so that the impression material can be accommodated in between the ridge and the metallic tray. Next, the material of choice always is impression compound when the tissues are healthy, because it gives you accurate extension and details whatever you require for a primary impression. So today I'll be talking about the same usage of the same material. So you have to soften the impression compound in approximately 60 to 65 degree temperature of water. Once it is softened, you have to knead it very nicely. Make sure you're not incorporating water bubbles into it while kneading, because if that happens, what will happen is you'll leave a void into your impression. So make sure water doesn't get incorporated when you're kneading the material. Once it is done, you can make a rope out of it and you can load it onto the tray as we have seen in the picture. After loading, in the center what you see is a trough. So this trough should be this trough or the dish should be created with the help of your finger, so that the crest of the ridge can be accommodated over here. Then you can invert the tray onto the patient's ridge. You have to create a ditch in between so that the crest of the ridge can be accommodated into this area, and then you have to do certain manipulation of the cheek and the lips so that the required details can be recorded onto the material. The manipulation of the patient's oral cavity will be demonstrated. You see that there is a trough created in the center. This trough or the ditch should be created so that the crest of the mandibular ridge can be incorporated properly into the impression compound. Later on, you should go ahead with manipulation of the patient's cheeks and lips and tongue so that accurate details can be captured into the impression. Once all the manipulation procedure is completed, this is what you achieve. This kind of an impression that you see when the borders have been recorded properly, the height of the flanges are accurate, when you see the frenums that has been, the area for the frenum that has been created, you can be sure that the impression is proper. It's very important to evaluate your impressions after you have made it. Evaluate it for certain irregularities, X's or voids that might have been accidentally incorporated into your material. If that is there, it is impression compound. You can always soften it again and just remake the impression without having to discard the entire impression that you have made. You can remake even a part of the impression that has not been recorded properly. Once you are satisfied with your impression, you can go ahead to pour your cast. Moving on to the next part, that is the maxillary preliminary impression. The steps remains the same. You have to select the accurate size of the tray such that the tray is seating well with adequate clearance of 5 mm between the ridges and the metallic tray. Posteriorly, in this area, you should make sure that the tray border is covering the hamular notch and the maxillary tuberosity. If you have found such kind of a tray, then that is the size of the tray you should go ahead with. What you can do is, again, when you're using impression compound, knead it properly. Do not incorporate water into it or else it will leave bubbles in your impression. So make sure you're kneading it without incorporation of water. Make a ball out of it, place it in the center of the tray in this area, and then with finger pressure, with the help of your thumb, you can evenly distribute it to other areas of your tray. Seat the tray as you can see in the image. Seat it with using the labial frenum as a guide so that you know that your tray is centered. Once that is done, you can go ahead with manipulation of the lips and cheeks and other areas in the oral cavity to achieve an impression that something looks like this. To achieve an impression that looks something like this. Now, in case of maxilla, it is very important to transfer the post-dam region or the PPS region onto the impression so that it can aid in fabrication of the custom tray that you will be fabricating onto your primary cast. For the purpose, what you can do is you can make use of an indelible pencil. You can go ahead and mark the posterior vibrating line. So for this, you will be using a T burnisher. First mark the hamular region and then ask the patient to say ah in an unexaggerated fashion and mark the posterior vibrating line. Then again you can go ahead with marking the anterior vibrating line. I'm going to just briefly explain about this thing because this particular part will be covered in detail when we are talking about border molding and final impression. So you have to mark the posterior vibrating line, then mark the anterior vibrating line, and then you can transfer it to the primary impression, and then you can go ahead with pouring the cast. Once that is done, your first step of complete denture fabrication is completed. That's it for today. I hope the session was informative. It was helpful for you. If there are any queries, I would be happy to take it. Please get back to me in the comment section and I'll be solving it for you. Thank you.